I just checked an order for my patient, and they're to get Rocephin 1 gram IM Q12 hours times 10 days. I went to my computer station and I checked the drug out on the Hippocrates site, and once I had all the information I needed, I went ahead and washed my hands. If I didn't have a sink available, I would use the hand sanitizer before I get started. I gathered the appropriate syringe that I need to give an IM injection. I got the Rocephin up from the pharmacy, and I chose the proper diluent, and of the ones that were available, I chose the 0.9% sodium chloride. When I did my calculation on the medication, when I add 2.1 milliliters of the sodium chloride, I will get 350 milligrams of the Rocephin per milliliter. And I chose that one because when I reconstitute it and get the final product, I will need to give 2.9 milliliters of the Rocephin to give the full gram, and that'll be under 3 milliliters, which is an appropriate dose to give a patient IM. Once I have done all that, I want to always make sure that I know the stability of my medication as well, and Rocephin is stable for 24 hours unrefrigerated and up to 3 days refrigerated. So I got my syringe available, so I'm going to take that and get it out of the packaging. So I have the appropriate syringe and the appropriate needle size. I have my sodium chloride, which I've checked as necessary. I take off the cover, keeping it sterile. And of the Rocephin, I'm going to take the cover off of that. And when I took it off, I went ahead and I happened to touch the stopper top, so I'm going to go ahead and wipe that off for at least 15 seconds with the alcohol swab. Once I get that completed, I'm going to go ahead and pull up the 2.1 milliliters of air into my syringe. I want to make sure I get an exact amount. I'm going to put that into my bottle of normal sodium chloride. Put the air in and go ahead and pull up the 2.1 milliliters, making sure there's no air pockets or problems. 2.1 milliliters. Then I'm going to take my Rocephin and I'm going to add the sodium chloride to it. Once I get it in, I'm going to take my needle and I'm going to go ahead and cover it sterilely. And I'm going to go ahead and rotate the Rocephin until it's reconstituted and there's no particles or anything in it. Gently rotate it, get it all completely dissolved. Once I get that done, I'm going to take an alcohol swab, take my Rocephin, and cleanse it off again, making sure I do it for at least 15 seconds. Make sure it's completely cleansed. And then I'll pick up my syringe again, and the final product should be 2.9 milliliters of the Rocephin. I put that in there. Just in case, I'll wipe it again, just to be sure. And put the air in. Pull out the correct dose, 2.9 milliliters, making 1 full gram of Rocephin to give to my patient. No air bubbles. Pull it out. Recap the syringe carefully, making sure you keep it sterile, and then you're ready to give it to the patient.